Now, the World Health Organization hopes it will revolutionize the way mothers are treated after pregnancy and save thousands of lives. Trials of a new drug have been finished designed to treat bleeding in post-pregnancy. The current drug used to combat maternal death stops working when exposed to heat, and 99% of deaths happen in low-income countries, often in hot climates. Well, I spoke earlier with Metin Gulmezgulu from the World Health Organization, who did this particular study, and Dr. Shiva Prasad Guda, professor in physiology, about how much of a game changer this new drug could actually be.
What we did is, in 2013, when we saw the data about the heat stability of this product, and that is the heat-stable carbetocin, we got excited because scientists, health professionals have been searching for a heat-stable oxytocin product, or a drug that helps the uterus to contract, the womb to contract after childbirth, for many years, but had failed. So this was the first time we really had good heat stability data. And what we did was to compare that to the current gold standard, that is the oxytocin, which we are recommending. And we did this study in about 30,000 women and showed that the heat-stable carbetocin is as safe and as effective as oxytocin.
And just in simple terms, just tell me, what sort of temperatures can this new formulation withstand, and what sort of temperatures can the current drug, the oxytocin, withstand?
So the data that the company has at the moment is 30 degrees centigrade stability for more than 3 years, and at 40 degrees centigrade for more than 6 months. And this is hugely superior to what oxytocin has at the moment.
So that's a massive difference. Dr. Guda, somewhere like India, just for our viewers watching around the world, in this area of maternal deaths, what are the sort of numbers we're talking about?
Yeah, it's a huge problem. Globally, it's estimated that more than 300,000 women die every year during pregnancy and childbirth, and unfortunately, India contributes almost 20% to this mortality burden, and that's not acceptable. And given that we know what works, but we're not able to deliver it to the women. Oxytocin has been recommended for the prevention of bleeding after childbirth, but the quality of the oxytocin that gets administered is questionable because of heat lability and cold chain issues, power outages.
And that's why this could revolutionize.
I think Ferring's heat-stable carbetocin.
And that's why this could revolutionize it. How quickly do you hope they can actually get through the regulators and you can be using it there on the ground?
Yeah, we are hopeful that we have very good quality data and we can present it to the regulatory authorities. We hope to convince them, and with WHO on board, we should be able to convince even the ministry to accept this drug as a viable alternative, and hopefully that will start saving lives.
Metin, let me go back to you there in Geneva, because, will WHO amend your guidelines to put this now on your list of essential medicines? Because that makes it easier for a place like India. Once you've done that, they can actually then change things in terms of their medical practices.
Yes, absolutely. So there are some parallel work going on at the moment. WHO will update its recommendations for preventing hemorrhage after childbirth in September, and it hopefully will be approved by October. And then, if recommended as expected, then we will put a submission for its inclusion in essential medicines list. At the same time, we will provide the study report to the company, Ferring Pharmaceuticals, for them to start with the regulatory submission processes. So we are trying to move as fast as we can.
I can see the doctor nodding and hoping that is exactly how it transpires. Metin, just a final thing in terms of the cost. How do you ensure that it isn't prohibitive? This is obviously a huge step forward, but the cost of this drug will be hugely significant in terms of saving those lives we were talking about.
Yes, so in 2013 we signed a memorandum of understanding between Ferring Pharmaceuticals and Merck Sharp and Dohme for Mothers, which is a social corporate responsibility project of Merck. And the three parties committed to providing an affordable and sustainable price in more than 90 countries, most of them low and lower middle income countries. So the drug has to be affordable, and it has to be an affordable alternative to what we have now. And I think the company is making huge efforts, and we are quite optimistic that they will be very close to that, what people are paying now for a quality oxytocin project.
A very significant breakthrough.